Today we will discuss retinal vascular disorders. ठीक है, जब आप लोग रेटिना पढ़ेंगे तो आप डिटेल में पढ़ेंगे different types of retinal pathologies like retinal vascular disorders, retinal fundal retinal dystrophies, उसके बाद इस तरह रेटिना की कुछ और बेसिकली ये वेस्कुलर और डिस्ट्रोफिक और डिजेनरेशंस। तो आज हम रेटिनल वेस्कुलर डिसऑर्डर्स को एक कॉम्पैक्ट फॉर्म में देखेंगे। अब जैसे नाम से पता लग रहा है, व्हाट आर द डिफरेंट डिजीजेस which affect the retina from vascular point of view, that is the vessels of the retina. There are some diseases which are well known and they are systemic diseases and they have an impact on the retina, like diabetes mellitus causes diabetic retinopathy. Similarly, hypertension causes hypertensive retinopathy, and there are some vascular disorders which are uh, secondary to these two major diseases, or some are independent of these two diseases, and some are may or may not be related to systemic diseases, like central retinal vein occlusion. जो वेन होती है सेंट्रल रेटिना की वो एकदम क्लोज हो जाती है। सेंट्रल रेटिनल आर्टरी ओक्लूजन, ब्रांच रेटिनल वेन ओक्लूजन, ब्रांच रेटिनल आर्टरी ओक्लूजन, समझ आ रही है? इसी तरह कुछ इंडिपेंडेंट ऑफ द सिस्टेमिक डिजीज है, जैसे ऑटो इम्यून डिजीज है, लाइक ईल्स डिजीज है, इन विच द blood vessels of the retina become inflamed. The vasculitis of the retinal blood vessels occur. So let's start briefly. As in today's 30-40 minutes lecture, I will try to concentrate on how these diseases affect the vein by affecting the retinal vasculature. And number one, these are retinal vascular diseases. Number one, diabetic retinopathy. Okay, now as you know, diabetes mellitus is a systemic disease which involves medium and small sized blood vessels. The basic pathology of diabetic retinopathy in all over the body is that it damages the spotting cells, that is pericytes. For example, if we take the retina, this is the picture of the fundus, this is optic nerve, and these are the arteries and veins. So if we take this blood vessel in an enlarged picture, this is a branch of a central retinal artery. So these are different cells in the artery, right? So normally, anatomically, there is each one spotting cell for each endothelial cell of the blood vessel. आपको ब्लड वेसल्स की वॉल्स के स्ट्रक्चर्स पता है ना? एपिथेलियम होता है, फिर उसके बाद इनर मोस्ट एंडोथेलियम होता है, you know that. So I am talking about the endothelium. In eye, the diabetic retinopathy, they affect the endothelium. Basically, to each endothelium there is one spotting cell which is called pericyte. There is a loss of pericytes in diabetic retinopathy. When pericytes are lost, then endothelium itself becomes damaged. So this is the basic damage which occurs in diabetic retinopathy. So when there will be damage of the endothelium, what will happen? the two things will happen. Number one, the plasma constituents from that blood vessel will leak into the retina, right? Understandable है ना? दूसरी चीज क्या होगी? There will be a factor of ischemia. The blood oxygenation पूरी नहीं होगी. And when there will be ischemia, then retina will have areas where it will not have enough oxygen. So two things: one is leakage, one is hypoxia. These effects create different structures. I will not go in detail of each disease, but ultimately what happens in diabetic retinopathy, there are formation of different uh, things, and diabetic retinopathy has been divided into three main stages: background diabetic retinopathy, pre-proliferative diabetic retinopathy, and proliferative diabetic retinopathy. And in general, what happens, keep in mind the basic pathology. There are hard exudates, okay? Uh, like for example, this is the retina. These are deposition of hard exudates. There are hemorrhages. मैं ये सारा आपको तीनों stages का बता रहा हूँ. There could be hemorrhages on the retina. There could be retinal edema. At any part there can be plasma. There can be in the third most stage in which hypoxia occurs, and it creates angiogenic factors, and in response to angiogenic factors, uh, what happens? New vessels are produced, and new vessels at the optic disc are created, and new vessels may also uh, uh, be created at the branches of the blood vessels. For example, somewhere here. So blood vessels at disc we call NVDs. That is new vessels at disc. It is a universal terminology. If they are present somewhere else, we call them NVEs. Means new vessels elsewhere. So now when new vessels will bleed, they will cause vitreous hemorrhage. Normally vitreous is transparent. I told you that three structures in the eye are transparent. Number one, cornea. Number two, lens. Number three, vitreous. If there is some opacity or blood in any of these blood vessels, it's a pathology. So when these blood vessels bleed, they will bleed and into the vitreous gel, and it will become vitreous hemorrhage. And along with the vitreous, it acts as a scaffold. That is, it makes a composition of a structure like fibrovascular membrane, which is attached with the retina, and it can do traction on the retina, and it ultimately may cause traction retinal detachment. So this was very briefly how diabetes and diabetic retinopathy may affect the retina. Now we come to the hypertensive retinopathy. Second is the हाइपरटेंसिव रेटिना. समझ आ रही है आपको? मैं डिटेल में हम जब पढ़ेंगे, then we will discuss each of these diseases separately. So hypertensive retinopathy is basically itself not a very serious problem usually, but as the hypertension in general, the first response of hypertension in body is vasoconstriction. That's why the blood pressure goes up. The same response occurs in the retina, and it is seen usually well in the young people, in which there is no atherosclerosis. You will see when you dilate the fundus and see the fundus with direct ophthalmoscope or 90D on the slit lamp, you will see that the blood vessels are constricted. How will you come to know? Because they are in the both eyes. Because in the individual of the same age with experience, you can assess that as compared to this age group, the blood vessels in this patient are more constricted. The patient will have no symptoms. Then you will send him for hypertension control. It is the treatment for hypertensive retinopathy when you find the constricted blood vessels, and there are some other features uh, in hypertensive retinopathy. I will tell you one or two. For example, this is the artery and this is the vein. So what happens? the this is the vein and this is the artery, for example. So when this artery crosses the veins, because of constriction and some atherosclerosis, it compresses this vein, and this vein, instead of going straight, it becomes like this. It is called AV nipping, arteriovenous nipping. It compresses the vein. समझ आ रही है? इसके कुछ साइन है, बोनेट साइन है, लेकिन अभी आप इतना ध्यान में रखें, थिंग्स लाइक दीज हैपन. Then there are copper wiring, silver wiring. We will discuss them when we will study the hypertensive retinopathy. Till now, the patient will have no real symptoms, but they can ultimately cause complications, usually in older patients. In younger patients, hypertensive retinopathy can do, what can it do? It can do a serious disease. That is, if this is the artery and it is constricted, and if it becomes totally occluded, let's see this artery. This is supratemporal artery and it has become so constricted that it has occluded. What will happen? This area will become hypoxic, and we call it branch retinal artery occlusion. When an expert eye specialist will see, then only he can clinically find that this area is pale as compared to the normal pink retina. Okay, but if it is small, usually patient and the doctor both usually miss it, and the symptoms are sometimes very subtle. For example, maybe mild scotoma in the visual field where this branch retinal artery occlusion has occurred. If it is large area, then the patient will definitely say, I cannot see in the superior visual field, yeah, inferior visual field. So this is the branch retinal artery occlusion. If it unfortunately affects the central retinal artery, right from at the optic disc because of constriction, that is the major problem. What it will cause? It will cause sudden blockage of oxygen in the retina, like because of embolus, like in a heart attack. Patient comes with a sudden painless loss of vision, usually young people, and retina becomes pale, and only the macula is visible, and it gives a picture where it looks like a cherry red spot, because this is the macula, and macula gets its blood supply from the retinal vasculature also, which is now occluded, but it still gets the blood supply from choroid, which is still functioning. So it is still getting a bit of oxygen. That is, the nature is trying its best to save the eye. So it will stand out red around this all pale area. समझ आ रही है मेरी बात की? तो इसको चेरी रेड स्पॉट बोलते हैं. ये विद इन 48 आवर्स डिसअपियर हो जाता है. तो इट इज़ एन इमरजेंसी. अगर 48 आवर्स के अंदर कोई इंटरवेंशन ना करे, जैसे आप पेशेंट को लिटा कर उसको आँख में मसाज करते हैं फॉर 20 मिनट्स, यू डू पैरासेंटेसिस, दैट इज यू पंक्चर द anterior chamber with the needle at the slit lamp to decrease the pressure in the eye. You give mannitol, all that things which lower the intraocular pressure. You give, if available, streptokinase injection like we give in myocardial infarction in anticipation of dislodging the embolus. Sometimes we emergency, very rarely, we try to perform vitrectomy, and if we can see the embolus by fundus fluorescein angiography, we can try to disengage it. But Unfortunately, the prognosis is very poor, and over 95% of the patient lose their vision permanently. So much so that patient becomes totally blind. He can't unfortunately even perceive the light. This is one of the most serious and few complications which you will encounter in eye. Like when we studied glaucoma, angle coil glaucoma, in which the third stage, acute congestive glaucoma, in which the patient comes with raised intraocular pressure with 60 or 80 mm mercury, that is also an emergency. इसी तरह ये भी एक emergency है. इसी तरह chemical injury एक emergency है आई में. So this is what the vascular disease or hypertension can do it secondarily. If the patient is relatively old, then there is a probability that instead of central retinal artery, his central retinal vein will occlude. When central retinal vein occludes, it ruptures, and you can see the blood patches in the flame-shaped hemorrhages, because the nerve fiber layer is like layers, like my you can see like my fingers. ये मेरी चार उंगलियां जुड़ी हुई हैं, तो इस तरह वो उसकी अलाइनमेंट लग इस तरह की होती है. तो यू भी इस तरह की आपको शेप नजर आएंगी. ये एक हेमरेज का पैच है, ये दूसरे हेमरेज का पैच. इस तरह आपको पूरे रेटिना के ऊपर अगर सेंट्रल रेटिनल वेन की हुई है ना, पूरे रेटिना के ऊपर आपको फ्लेम शेप्ड हेमरेजेस नजर आएंगे. और अगर इस्कीमिया है, देन यू विल सी कॉटन वूल स्पॉट्स. कॉटन वूल स्पॉट्स का मतलब है जो द एक्सॉन्स ऑफ द गैंग्लियन सेल्स हैं वो इस्कीमिक हो गए हैं, एंड दीज आर एरियाज विच आर डेड नाउ. कॉटन वूल स्पॉट इसलिए कहते हैं कि वो जो रुई के वो होते हैं ना गोले, दे लुक लाइक दैट. If they are less than 5 in counting, we call it non-ischemic central arterial vein occlusion, which has a very good prognosis, and even without treatment, in 3 to 6 months, these hemorrhages resolve after controlling of the blood pressure and other things, and patient may attain his vision to 6/6. But if it is ischemic, uh, there are ischemic element is there, and more than 5 cotton wool spots is said to be the cut-off point, then the prognosis is poor and patient may not regain his full vision. So this is central retinal vein occlusion. Nowadays we used to give intravitreal anti-VEGF injections to increase the speed up the recovery. Similarly, we can do the scattered laser, argon laser, to speed up the process of recovery. Similarly, like branch retinal vein, central retinal vein occlusion, only a branch can affect, like branch retinal artery occlusion. There can be branch retinal vein occlusion, in which vein becomes ruptured, and only in one part there will be blood. Okay, so it will have defects, visual field defects only in that area, and it will also by its own recover within 3 to 6 months. So we have learned, number one, diabetic retinopathy directly affecting the retina, hypertensive retinopathy indirectly affecting the retina, and both of these, hypertension and diabetes, affecting indirectly by by affecting the retinal arteries and arterioles, and veins and venules. They are causing retinal artery occlusion and branch retinal artery occlusion, central retinal vein occlusion, and branch retinal vein occlusion. These are can be independent or secondary to these systemic disease. समझ आई? ये अभी हमने यहाँ तक पढ़ा. बेसिकली ये जो अभी तक हमने जितना पढ़ा, ये दो, उसके बाद हमने सेंट्रल रेटिनल आर्टरी ओक्लूजन और इसी का पार्ट सेंट्रल रेटनल सेंट्रल रेटनल articuation branch retinal articuation, then central retinal vein occlusion, and branch retinal vein occlusion. समझ आ गई ना? ये मेन these are the main vascular disorders of the retina. इसके अलावा रेयर डिजीज है like some systemic diseases, some granulomatous inflammations and autoimmune diseases like tuberculosis in our part of the area, sarcoidosis. Uh, these usually cause choroiditis, not vasculitis, but sometimes they can involve the blood vessels also. And there is a very rare idiopathic disease, autoimmune, which is called Eales disease, where the linings of the blood vessels become inflamed, and it occurs in young patients without any reason, unfortunately. And with the passage of time, because of vasculitis, inflammation, there is leakage of the proteins and all that stuff, and macula is involved. Patient mm, can lose his total vision, or if treated with some intravitreal injections or vitrectomy, we may save some of the vision, but most of the time Eales disease is a very fatal disease. So that is all for today. Thank you very much.